Good evening, everyone, and welcome to OET Speaking Speculation. This is me, Hannah Kishaji.
Hi everyone, this is me, 𝐎𝐤𝐞𝐚 𝐤𝐴 and we are from 𝐒𝐄𝐓 Academy back with another OET Speaking Speculation. It's been few days we came for the live together, right?
Yes, together.
Yes. So we've been getting a lot of questions about where is a mock test presentation and demonstration.
Yes.
So don't worry, we are here back with another mock test demonstration for you guys.
Yes.
So good evening to everyone, and we are very happy to be here today, and we hope you guys are doing really well too. And we have an exam very soon this Saturday, so
Yes.
there would be a lot of people among you who are planning to write the exam this Saturday. So we wish you all the very best. You don't have to be nervous, don't panic. Do your best.
Yes.
Okay, this is your time. This is going to be your time. Yeah, exactly.
Yes.
This is your time, and you will definitely get it. So make sure that you give your best. Okay, so don't worry about it. So I was actually taking the speaking club today.
Yeah.
So you guys know that we have the speaking club every day from 4 to 5.
5.
So a couple of my students in that segment was telling me we have the exam day after tomorrow and we are nervous and everything like that. So I was like, don't be nervous. It's okay. You guys got it. You guys can definitely do it. You guys know the strategies.
Yes.
All the tips. You've been practicing really hard, so hard work definitely pays off, so don't worry.
Absolutely.
So all the very best to all the students who are taking the exam this Saturday.
Yes, sure. Do the
Yes.
best and leave the rest.
Absolutely. Yes, so we all have picked another exam model cue card for discussion today as well. You guys know how this drill goes. So
Yes.
if you are constantly watching our lives, you guys know how this will be done. We will be first giving you the 3 minutes preparation time. At the same time, I'll be also preparing because I'll be playing the part of the nurse and Hannah will be handling the patient's part.
Yes.
നമ്മൾ ഈ ഒരു ക്യൂ കാർഡ് സ്ക്രീനിൽ ഡിസ്പ്ലേ ചെയ്യും. At that time, you will also get the time to prepare. ആ ടൈം എക്സാക്ട്ലി നിങ്ങൾ യൂട്ടിലൈസ് ചെയ്യുക. കൃത്യമായിട്ട് എങ്ങനെയായിരിക്കും ഒരു കാർഡ് കിട്ടുമ്പോൾ നിങ്ങൾ പ്രിപ്പയർ ചെയ്യുന്നത് അതേപോലെ തന്നെ പ്രിപ്പയർ ചെയ്യുക. And after that, we will show you the demonstration. And we'll have the discussion too. So make sure you stay with us till the end of this live session to get the discussion part as well. Okay? Yes, so we have many people joining us. Good evening, everyone.
Yes, good evening, everyone, and I hope all of you are practicing. And like she said, we know that you've been waiting for the mock test, like the role play that we do, the demonstration that we do, because we actually share a lot of strategies and tips here, and you get how it has to be done when it is between a patient and a nurse, so you get a complete idea about it.
That's right. So Jilmi Joy is saying good evening. Hello Jilmi, good evening to you as well. All right, so I think without wasting much time, we can do the role play. Okay, so stay tuned. When we show the cue card for the preparation time, make sure that you guys go through it and prepare it along with this. Okay?
Yes.
All right.
You'll have 3 minutes to prepare, and here is your cue card.
All right.
Your 3 minutes is over.
May I know the name of the patient, please?
Joanna.
All right.
Okay, so your 5 minutes starts now.
Good evening.
Good evening.
My name is Richa. I'm a registered nurse from Greenwich Hospital. Are you Miss Joanna?
Yes, I am.
Hello there. I'm here to dress your wound and assess your progress. Is it the right time to talk to you?
Sure, it is.
All right, thank you so much. So as I mentioned, I'm here to look at your wound and to dress it and also to check your progress. So Miss Joanna, can you please tell me, how have you been feeling since discharge? Do you have any difficulty with mobility?
No, I don't actually have any difficulty with mobility.
And what about your general being? Like, do you feel tired all the time?
Yes, I feel a bit tired and weak, but I think it's because of what I went through, what I had to go through.
I totally understand that. So what about your appetite?
My appetite has been normal, but I don't eat as much as I used to.
I totally get it. So it is very important that you have a good nutrition at this time. From what you told me, I understand that you've been feeling tired almost all the time, and on top of it, you are not eating enough food as well. So I would like to tell you the importance of having a good nutrition at this time, because it helps to aid your recovery and also helps in building your strength as well. So I hope you understand the importance of having a good meal. Okay, so along with this, I would also like to ask you a couple of questions related to your food and your fluid intake. May I?
Yes, sure.
Can you tell me about the amount of food and fluid that you take in, as well as how often do you do that too?
I don't take them very often, but I've been enjoying soups and smoothies lately.
Smooth, okay. All right, I'll make a note of that. So that being said, I would like to discuss a few things with you, especially I would like to give you some diet suggestions. Is that okay with you?
Yes, sure.
So make sure that you try to eat little but often. What I'm trying to say is you can reduce the portion of your meal and you can increase the number of times you take it. Okay. And you can include your preferred foods. If you have any specific foods that you like to eat all the time, you can include that, but make sure that you have high calorie foods which is highly nutritious, and also you need to include supplemental nutritional drinks as well. Okay. And I can arrange a meeting with the hospital dietitian. He will be helping you in arranging a good balanced diet according to your body preference. Will that be okay with you?
Yes, it will be.
Okay, so moving on, I would like to ask you a couple of questions about your symptoms as well, because it's important I know about it. Do you experience any pain?
No, I don't.
Do you feel feverish?
No.
Did you notice any swelling?
Not really.
Okay, what about your sleep? Are you getting good sleep?
Not really. I'm actually having trouble sleeping.
I totally get it. I'll make a note of all these things and I'll inform the doctor about it as well. So is there anything else you would like to address with me?
No, but I would love to know why I'm not recovering.
That's a very reasonable query from your side, and I understand that you must be confused about why it is taking a lot of time. But let me reassure you that the fatigue that you're experiencing right now is quite normal after this condition. You don't have to worry too much about it, and even though it is a slow process, there will be a gradual improvement in your condition as well. So you don't have to worry about why you're not improving. Definitely you will improve, but you just need to give it some time and follow all the instructions properly. Okay? And do you have any other concerns?
No.
Alright, so I reassure you that you don't have to worry about your current condition. As I mentioned, your recovery is going as expected, and there is no need for any worries. So I'll explain what we are going to do next. So I need to check and redress your wound, and then I have to check your vital signs as well. Alright, I need to ensure everything is within a normal range. That being said, I think it is really good if you can meet the doctor and have a consultation, for which I can book an appointment. Is that okay with you?
Yes, it is.
I'll definitely look into it. So I hope I have clarified everything to you. Would you like to ask me anything else?
No.
Okay, in that case, with your consent, can I please check your wound and redress it for you?
Sure.
All right, thank you for your cooperation. I will proceed with it.
Okay, thank you.
Okay,
Your
thank you.
5 minutes is over.
All right. Okay, so that was the end of the entire presentation. This was a very easy card, right?
Yes, it was.
And this was one of the exam model cue cards too, but not a recent one. I would say it goes back into maybe 5 or 6 months or more than that, but less than a year.
Yes.
Okay, so you need to understand the common trends that you can expect for the examination, what type of questions you can expect, എങ്ങനത്തെ type of explanations ആയിരിക്കും വരുന്നത്, type of patients എന്തൊക്കെയാണ്, മിക്കതും നമുക്കൊരു ഇൻഫോർമേറ്റീവ് ടൈപ്പ് ഓഫ് ടാസ്ക് കാർഡ്സ് വരാറുണ്ട്. സോ ഇൻഫോർമേറ്റീവ് ടൈപ്പ് ഓഫ് ടാസ്ക് കാർഡ്സിൽ തന്നെ ഏത് ടൈപ്പ് ഓഫ് ഇൻഫർമേഷൻ. Okay, sometimes you might get patients who are really concerned and very doubtful about certain things. അവർക്ക് എത്ര പറഞ്ഞു കൊടുത്താലും അവർക്ക് ഭയങ്കര ഡൗട്ട് ആയിരിക്കും. ആ ഒരു കാറ്റഗറി ഓഫ് പേഷ്യൻസ് വരാറുണ്ട്. അതല്ലെങ്കിൽ ഇന്ന് നമ്മൾ കണ്ടുപോലത്തെ വളരെ കോപ്പറേറ്റീവ് ആയിട്ടുള്ള അധികം ഡൗട്ട്സും കൺസേൺസും ഒന്നും ഇല്ലാത്ത ടൈപ്പ് ഓഫ് പേഷ്യൻസും നമുക്ക് വരാറുണ്ട്. സോ യു നീഡ് ടു അണ്ടർസ്റ്റാൻഡ് ഇതിൽ ഏത് കാറ്റഗറി വന്നാലും എങ്ങനെ ഡീൽ ചെയ്യണം, എങ്ങനെ റെസ്പോണ്ട് ചെയ്യണം എന്നുള്ള കാര്യങ്ങളൊക്കെ നമ്മൾ കുറച്ചുകൂടെ നല്ല രീതിയിൽ പ്രിപ്പയർഡ് ആണെങ്കിൽ തിങ്സ് വിൽ ബി ലിറ്റിൽ മോർ ഈസിയർ ഫോർ യു വെൻ യു ഗെറ്റ് സച്ച് എ പേഷ്യൻറ്റ് അറ്റ് ദാറ്റ് ടൈം. അല്ലാതെ നമ്മൾ എക്സാമിന് ചെല്ലുമ്പോൾ അയ്യോ ഇങ്ങനത്തെ ഒരു പേഷ്യൻ്റ് ഒന്നും ഞാൻ എന്താ ചെയ്യേണ്ടത്, ഐ ഡോണ്ട് നോ ഹൗ ടു ഹാൻഡിൽ ദിസ് സിറ്റുവേഷൻ എന്നുള്ള രീതിയിൽ നിങ്ങൾ വറീഡ് ആയിട്ട് കൺസേൺഡ് ആയിട്ട് നിങ്ങൾ ഇരിക്കുവാണെങ്കിൽ യുവർ പെർഫോമൻസ് വിൽ ബി എഫക്റ്റഡ്. യു വോണ്ട് ബി ഏബിൾ ടു ഡു യുവർ ബെസ്റ്റ് or give your best there. So always make sure you know what type of categories can be asked. ഏത് ടൈപ്പ് ഓഫ് പേഷ്യൻസ് നിങ്ങൾക്ക് കിട്ടാനുള്ള ചാൻസ് ഉണ്ട്, ഇങ്ങനത്തെ ഒരു പേഷ്യൻ്റ് വന്നാൽ എന്തൊക്കെ രീതിയിൽ അല്ലെങ്കിൽ ഏതൊക്കെ രീതിയിൽ എനിക്ക് റെസ്പോണ്ട് ചെയ്യാം, ഏതൊക്കെ റീഅഷ്യൂറൻസ് ആയിരിക്കും ആപ്റ്റ് ആയിട്ട് എനിക്ക് അവിടെ പറയാൻ പറ്റുന്നത്, ഇതുപോലെയുള്ള കുറേ കാര്യങ്ങൾ പ്രീ പ്ലാൻ ചെയ്യുകയാണെങ്കിൽ തിങ്സ് വുഡ് ബി ലിറ്റിൽ മോർ ഈസിയർ ഫോർ യു വെൻ യു ആർ ഡീലിംഗ് വിത്ത് ദ ടാസ്ക്. യെസ്, വാട്ട് ഡു യു തിങ്ക് അബൌട്ട് ദിസ് കാർഡ്?
This card was actually pretty easy, and it's a different one. Most of the time you get cards when the setting would be the clinic, and this time we have home, which
clinic,
is
hospital.
It's everything related to the patient is coming to this place.
That's right.
And here the nurse is going there. So there is slight difference in the way you're introducing. You may confirming that that is the person you are you meant to go to.
Totally.
And then you're telling them why you've come there, and that you do with clinic and hospital. But there is a slight difference in the introduction part when it comes to home visit, I guess.
That's right. And these changes are very minute changes too.
Yes.
When I explain the changes, this is how you have to do it. You might not be even listening to that point, or you will not be concentrating in that point. The reason being, I'll give an example there. നമ്മൾ നോർമലി ഇൻട്രൊഡ്യൂസ് ചെയ്യുന്നത് ഗുഡ് മോർണിംഗ്, ഐ എം റിച്ച, ഐ എം വൺ ഓഫ് ദ രജിസ്റ്റേർഡ് നഴ്സസ് വർക്കിംഗ് ഇൻ ദിസ് ഹോസ്പിറ്റൽ. ബട്ട് വെൻ യു ആർ ഡൂയിങ് എ ഹോം വിസിറ്റ് യു കാൻ സേ ഐ വർക്ക് ഇൻ ദിസ് ഹോസ്പിറ്റൽ ബിക്കോസ് യു ആർ നോട്ട് physically present in that hospital. You are at the other person's house. So you have to say I'm from. Okay, so ഇതൊക്കെ വളരെ മൈന്യൂട്ട് ആയിട്ടുള്ള കാര്യങ്ങളാണ്. ആൻഡ് സ്റ്റുഡൻസ് they don't actually pay much attention. അവരിത് വളരെ കോൺസെൻട്രേറ്റ് ചെയ്ത് ഭയങ്കര സീരിയസ് ആയിട്ട് കൺസിഡർ ചെയ്യുന്ന ഒരു പോയിന്റ് അല്ല, പക്ഷേ അത് വളരെ ഇമ്പോർട്ടൻ്റ് ആയിട്ടുള്ള ഒരു ഇമ്പാക്റ്റ് കൊടുക്കുന്ന ഒരു പോയിന്റ് തന്നെയാണ്. Because when you're saying if I'm at Hannah's place and I'm saying hi, I work in this hospital, Anna will be like, this is not a hospital, this is my house. So technically you have to pay attention to these minute things, which is very crucial, right? And another thing is introduction പറഞ്ഞതുപോലെ I won't say this is the only method you can do for this. I have seen people doing steps for this, like hello, good morning, my name is this Miss Joanne's house, are you Miss Joanne, is this a good time to talk to you? So there are multiple steps for that too. If you feel comfortable doing like that, go ahead, go for it, no problem. Nobody is stopping you. If you feel like logically the correct ആണ്, ഈ ഒരു കോണ്ടെക്സ്റ്റ് ഇങ്ങനെ ചെയ്താൽ എന്താ തെറ്റ് എന്ന് നിങ്ങൾക്ക് തോന്നുന്നു കറക്റ്റ് ആണെങ്കിൽ you can definitely do it. അതല്ലാതെ ഇപ്പോൾ നമ്മൾ ഈ ലൈവിൽ കണ്ട ഇത് മാത്രമാണ് ഒരേ ഒരു ഇൻട്രൊഡക്ഷൻ എന്നൊരു പോയിന്റ് ഇല്ല. There is no script for OET speaking, so you can go forward with any method that you find appropriate and logical. I'm repeatedly telling you that should be logical. ചുമ്മാ റാൻഡം ആയിട്ട് നമുക്കൊന്നും പറയാൻ പറ്റില്ല. ആ കോണ്ടെക്സ്റ്റിന് സ്യൂട്ടബിൾ ആവുന്ന ലോജിക്കലി റീസണബിൾ ആയിട്ടുള്ള ഒരു ഇൻട്രൊഡക്ഷൻ ആയിരിക്കണം. So here what I did is I greeted and I collected the name of the patient, because obviously when I'm going to the other person's house, I need to know who is the person that I'm going to meet. So I'll take that information from the hospital before I leave. So, and the reason why I introduced myself in this context, sometimes students get this concern like it's a home visit and it's mentioned the patient was admitted then got discharged. So isn't that like a situation where the patient knows you? Why do you have to introduce yourself again? The reason being, nowhere in this cue card you cannot see any portion here which is saying that you have met this person before, you have been taking care of this person before, or you had spoken to this person before.
Yes.
If it is mentioned like, it was your patient, you have been nursing this patient, you have been taking care of this patient, or it is just given you have examined the patient. If things like this is mentioned, then yes, you can skip your introduction. കാരണം ഇങ്ങനത്തെ സിനാരിയോസിൽ നമ്മൾ അസ്യൂം ചെയ്യുകയാണ് ഓൾറെഡി ഒരു കോൺവെർസേഷൻ അവിടെ കഴിഞ്ഞിട്ടുണ്ട് എന്ന് നമ്മൾ അസ്യൂം ചെയ്യാണ്. സോ വി വുഡ് നോ ഓൾറെഡി. ഇപ്പോൾ ഹാനയ്ക്ക് എന്നെ അറിയാമെങ്കിൽ ഞാൻ എല്ലാ ദിവസവും വന്നിട്ട് ഹായ് ഹാന ഐ എം റിച്ച് എന്ന് പറയേണ്ട ആവശ്യം വരുന്നില്ല. സെയിം ലോജിക് വർക്ക്സ് ഹിയർ. പക്ഷേ ഇവിടെ നമുക്ക് അതൊന്നും കാണാൻ പറ്റുന്നില്ല.
Yes,
it's just mentioned the patient was there, the patient got discharged 3 days ago എന്നൊരു ഇൻഫർമേഷൻ മാത്രമേ ഉള്ളൂ. അതല്ലാതെ നമ്മളുടെ പേഷ്യൻ്റ് ആയിരുന്നോ നോ, നമ്മൾ നോക്കിക്കൊണ്ടിരുന്നത്. അതായത് ലൈക്ക് ഇപ്പോൾ സേ ഫോർ എക്സാമ്പിൾ ഹാനയാണ് ആ nurse and I am the patient and she knows the details of me, like this is my name, I was admitted there, I have this problem എന്നൊക്കെ ഹാനയ്ക്ക് റിപ്പോർട്ടിൽ നിന്ന് കിട്ടുന്നുണ്ട്. പക്ഷേ ഞാനും ഹാനയുമായിട്ട് സംസാരിച്ചിട്ടുണ്ട് എന്നൊരു കോണ്ടെക്സ്റ്റ് അവിടെ വരുന്നില്ല. ഓക്കെ, സോ അതുകൊണ്ടാണ് ഹാന വീട്ടിൽ വന്നപ്പോൾ ദിസ് ഇസ് മീ എന്നുള്ള രീതിയിൽ ഇൻട്രൊഡക്ഷൻ പറഞ്ഞിട്ട് വേണം അത് ചെയ്യാനായിട്ട്. ഓക്കെ, സോ ഓൾവേസ് മേക്ക് ഷുവർ യു നീഡ് ടു തിങ്ക് അബൌട്ട് whether you need your introduction in non-case scenarios.
Yes.
Okay, yes. So we have a lot of people saying good evening. We got really busy explaining the points, so we got kind of carried away with it. So Gigi, okay, we have to start here. So Jopita, hi, good evening. Anish, Josie, Abhirajan,
Yes.
Jinsha,
Gigi, Johnny, Shija, Ramya, Dar, okay, Libya.
okay, Jifia, I think it is Jifia. Okay, hi, good evening to everyone. And Anishibu, hello, good evening. We hope you are having a really good time and your preparation is going well as well. So Dar has a question. Sometimes we go faster than a normal speed of communication. Any suggestion? Okay, well, it totally depends on a person's speed. ഇപ്പോൾ ഹാനയാണെങ്കിലും ഞാനാണെങ്കിലും വി ആർ വെരി ഫാസ്റ്റ് സ്പീക്കേഴ്സ്. ലൈക്ക് വി ടോക്ക് റിയലി ഫാസ്റ്റ്. വി നോ ദാറ്റ് ലൈക്ക് നോർമൽ കോൺവെർസേഷൻ ഒക്കെ ഞങ്ങൾ ഭയങ്കര വി ഡോണ്ട് ഹാവ് ടൈം ടു വേസ്റ്റ് ടു കമ്മ്യൂണിക്കേറ്റ്. സോ വി ഓൾവേസ് കമ്മ്യൂണിക്കേറ്റ് വെരി ഫാസ്റ്റ്. അത് നോർമലാണ്. ചില ആൾക്കാർ വളരെ വേഗത്തിൽ സംസാരിക്കുന്നവരുണ്ടാവും. ബട്ട് വെൻ ഇറ്റ് കംസ് ടു എ സിറ്റുവേഷൻ വെയർ ഇറ്റ് ഈസ് ഡിമാൻഡിങ് ദാറ്റ് യു ഹാവ് ടു കൺട്രോൾ യുവർ റേറ്റ് ഓഫ് സ്പീച്ച്, you should do that. It's a must. You have to. The reason being, you have the criterion which is saying intelligibility, which is actually the clarity of speech, and you have fluency, which is actually looking into the rate of speech. So idu random ningalku nalla score kittanamengil you need to work on your rate of speech. The reason being, when you talk really fast, the person who is sitting next to you should be able to understand the points that you are saying. If they strain to understand the point, that means the clarity of speech is not that good, so it will affect your score and you will get a lesser score for intelligibility. Second thing is fluency. If they feel like you're going too fast, your rate of speech is uncontrollable and it shows like in a way it is showing that you are in a rush to complete the task, you're not paying attention to the patient's requirements or the needs, then you will lose score there. Not just there for understanding patient's perspective, you will lose score for relationship building. So as a whole, ഒരുപാട് വേഗത്തിലാണ് സംസാരിക്കുന്നതെങ്കിൽ പല ക്രൈറ്റീരിയയിൽ നമുക്ക് സ്കോർ പോകാൻ ചാൻസ് ഉണ്ട്. And if you worry with the speed, what I can suggest is ഒന്നാമത്തെ കാര്യം നമ്മുടെ കൺട്രോളിലുള്ള ഒരു കാര്യമാണ്. I cannot go to Hannah and say, Hannah speed കുറയ്ക്കാം. I can only verbally say that. അത് കുറയ്ക്കണമെങ്കിൽ Hannah തന്നെ തീരുമാനിക്കണം, I have to go slow. What do you have to say about this?
I think sometimes people go really fast when they're in the examination hall or something. That's because they're nervous. That's just one of the ways they take out their nervousness or the way they're feeling when they're in the examination hall. So it's basically about your emotional state. Just telling yourself to be calm and relaxed when you're at the examination hall. So for which you have to have a lot of practice, like I always say, to help you with your nervousness. You have to go for a lot of mock tests and stuff like that. And just being relaxed is just fine. Sometimes when somebody talks really fast, I remember when I was a child, I would even talk really fast, even in my mother tongue. So what my parents have done, or what people around me have done, is just calm down, just relax. Can you slow down a bit? So it's about relaxing, and we're able to do that. We're able to speak slow. Even now at times when I'm explaining things, I feel like, okay, I'm going really fast. And then I tell myself, just calm down. So I'm someone who has actually dealt with that problem, so I can really give you tips on that.
We can relate to that, totally we
Yes.
can. So what I personally do to control my speed is, when I talk and I realize I'm going really fast, my psychological notion is kind of like, yeah, Richa, you're really fast, you have to slow down. And then I take a small pause and then I start again in a slow pace. That's
Yes.
how I do it. And I also suggest my students to do the same thing too.
Yes.
When they go for really fast, I ask them to stop for a bit and then
Yes.
start again. Yes, there will be a pause in your presentation, but that is actually for a good cause.
Yes,
Like,
absolutely.
especially when you are preparing right now, you're doing the preparations, doing the one-to-one sessions and all. If you're taking that small pause in your preparation, that's not going to cause any harm.
Absolutely.
Okay, you can make that mistake. And another thing is, നമ്മൾ പുതിയ സെന്റൻസുകൾ പഠിക്കുമ്പോഴും students are like, ഞങ്ങളത് by heart ചെയ്തു, we have learned it, we have like memorized every point, but when it comes to the presentation, I'm not able to use it or place it in a position where I actually have to say this. And I tell the students, what you have to do is, you have to prepare the list of sentences that you're going to use, or you have planned that you will use, and bring that paper next to you. And you should tell yourself, when I'm doing task number 2, I will do this particular sentence. When I'm doing task number 4, I'll say this particular reassuring point. You have to physically tell yourself, okay, I have to stop, I have to read it, and that transition will take time.
Yes.
Okay, ആ ഒരു പോയിന്റ് എത്തുമ്പോൾ, ഓക്കെ, ഇനി ഞാൻ ഏതാ പറയേണ്ടത്, ഇങ്ങനെ നോക്കി അത് നോക്കി വായിക്കുന്ന ആ ഒരു ട്രാൻസിഷൻ ടൈം will be there. It won't be fluent, but അതങ്ങനെ പോയാലും your success point is you included that sentence in your presentation. അത് ഒരു പ്രാവശ്യം ചെയ്തു, രണ്ടാമത്തെ പ്രാവശ്യം ചെയ്യുമ്പോൾ കുറച്ചുകൂടെ നമുക്ക് ആ ഒരു പോസ് കുറയ്ക്കാൻ പറ്റും, മൂന്നാമത്തെ പ്രാവശ്യം ആകുമ്പോൾ ഓട്ടോമാറ്റിക്കലി നിങ്ങൾക്ക് അത് പറയാൻ പറ്റും. ഓക്കെ, ലൈക്ക് വൈസ് സ്പീഡിൻ്റെ കാര്യം വരുമ്പോഴും, സ്പീഡ് കൂടുവാണെന്ന് നിങ്ങൾക്ക് തോന്നുന്ന ആ സമയം, take a small pause, slow down and then start again.
Yes.
Okay, that is what you have to work on it.
And what you guys are doing is actually really good. Realizing that you have a problem like that is the first step. So every time when you're speaking, then also you should realize when you're going really fast. Okay, I'm going really fast. So I can just show you a demonstration. So I'll be just talking really fast like this, and then I could be like, okay. And this pause was pretty long, but what I'm saying is, while I'm explaining it, it would be long. Then you can go slow. So this is what I'm trying to say, and you have to do this. You have to take effort. You have to put in effort to change it. You see, if you plan to do it, if you take those pauses, you are able to do it.
It's an external force that you're bringing in, right?
Absolutely.
Like what she have done right now. She was talking really fast, and then she understood I'm trying to explain this to the students. Then she slowed down. I can relate to it because I do the same thing. So when Hannah goes fast, എനിക്കറിയാം ഹാനയ്ക്ക് തന്നെ മനസ്സിലാവുന്നുണ്ട്, ഹാന വളരെ വേഗത്തിലായി ഇപ്പോൾ സംസാരിക്കുന്നത്, പെട്ടെന്ന് തന്നെ ഹാന സ്ലോ ഡൗൺ ചെയ്യും, because she's getting that in her mind. Okay, I'm going really fast, I have to slow down. So when you get that hint that you're going fast, slow down. അതെല്ലാം നിങ്ങൾക്ക് തരുന്ന ഒരു ഹിൻ്റാണ്. നിങ്ങൾ അപ്പോൾ ഒന്ന് ബ്രേക്ക് ചെയ്യുക, സ്ലോ ഡൗൺ ചെയ്യുക, ഒന്നുകൂടെ റീസ്റ്റാർട്ട് ചെയ്യുക, ദാറ്റ്സ് ഓക്കെ. അത് കുറച്ച് നാൾ ഇങ്ങനെ ഒന്ന് പോസ് ചെയ്ത് റീസ്റ്റാർട്ട് ചെയ്ത് അങ്ങനെ വരുമ്പോഴേക്കും ഇറ്റ് വിൽ ബി ഓക്കെ ഫോർ യു. യു വിൽ ബി ഏബിൾ ടു കൺട്രോൾ യുവർ പേസ്.
Your brain will tell you, because otherwise, you know, if when you're going fast, it wouldn't always flow. The words wouldn't always flow. You would make mistakes. Two words would just merge, and you would make you would feel like some words are tongue twisters. You would have problems.
You might omit some words too.
Absolutely.
You want to give the complete pronunciation there.
Yeah, and then you would become more nervous, and then you would start stuttering and stammering. So things would just get worse. And when you know that, just make sure, like what she said, while you're practicing, you can do anything while you're practicing, right?
Yes.
Just make sure you take a pause, just relax yourself, train yourself to speak slow, and just overcome that problem that you're having.
We have another question, which is the opposite of this, okay? What about if a person talks slow, how can we make it?
Okay.
So we have both the ends. What if we talk really fast, and what if we go very slow? Both are dangerous, okay? Both are harmful for your auditive speaking. You're too boring to listen to, first and foremost. It takes a lot of patience. Talking really slow to understand. We'll be like, just cut to the chase. Don't lag too much. And I have noticed students who talk really slow, what they have is they have huge gaps between the words.
Yes, that's why it's
Will be like, good morning, you have a lot of word gaps. You need to practice talking, because whenever I speak about fluency, I always tell my students about fluencies of two types, mental fluency and your verbal fluency. Because whatever you have here, it should be able to be uttered, or you need to announce it at the same time you think about it. That is what is called proper fluency. ആ ഒരു മസിൽ പ്രാക്ടീസ് ഒക്കെ നിങ്ങൾക്ക് കറക്റ്റായിട്ട് പ്രൊനൗൺസ് ചെയ്യാൻ പറ്റണം, കറക്റ്റായിട്ട് അത് നമുക്ക് പറയാൻ പറ്റണം എന്നുണ്ടെങ്കിൽ you need that practice too. So what you can do is you can take paragraphs like English paragraphs every day, read aloud. So you will get the muscle practice, you get the fluency here, the physical fluency will be improved. Mental practice is how you read and observe words, learn the sentences, vocabulary learning. All these things will help you in the mental practice. Then what you have to do is you have to club both of this and then practice it with the OET sentences. First you can start off with the basic English things, and then you can move into OET related sentences and conversations, and it will definitely help you to speed up a little bit. So not too fast, not too slow, you need to have a moderate rate of speech. Always remember that point.
Absolutely. And I think it's about, when it comes to being slow in speech, I think you have to identify what causes that problem. Like she said, for some people it is because that's their nature. They
default.
Default. They actually speak slow. But for some other people, they're slow because they're taking time to think words, they're taking time to think about phrases that they want to use. For people who are speaking very slow, and which is their nature, you have to focus on improving your speed by just doing micro listening or shadowing technique.
That's right.
Shadowing technique can work really well for you, and even this works even for people who are taking time to think about words, think of words or phrases.
You can explain that to them, like
yes,
they might not know
shadowing.
what is shadowing.
Yes, I will be explaining. I'm going to explain it. So shadowing is just nothing. What you do is, sometimes, have you felt like when you watch movies, the dialogues are really fast and you can't even follow what they're saying? So what I want you to do is just take a movie scene, or you take a clip of a speech by a famous person or a native English speaker, and then you listen to it. And I think I've explained it in many of the lives here, and I'll repeat again. You have to repeat what they're saying. For example, I remember this dialogue from a sitcom or series. Mr. John, your rent is due. Your rent is due. So he says, connecting those words, and sometimes this can help. Connecting words can help improve your the speech, the fluency. So it's like when I say, what's your name? There is much better like fluency than asking what is your name.
So the simple thing what they can follow is, I don't know whether this is grammatically correct or not, but I find it very beneficial for me. നമ്മൾ പറയുന്ന ഒരു വാക്കിൻ്റെ അവസാനത്തെ ലെറ്റർ അത് കുറച്ചൊന്ന് എക്സ്റ്റെൻഡ് ചെയ്ത് അടുത്ത വാക്കിൻ്റെ ആദ്യത്തെ ലെറ്ററായിട്ട് ക്ലബ് ചെയ്താൽ യു വിൽ ഗെറ്റ് ദാറ്റ് കണ്ടിന്യൂറ്റി ഓഫ് യുവർ സ്പീച്ച്. ലൈക്ക് ഇപ്പോൾ ഹാന പറഞ്ഞ പോലെ വാട്ട് ഈസ് യുവർ നെയിം എന്നുള്ളത് വാട്ടിൻ്റെ ടി വിച്ച് ഇസ് ദ ലാസ്റ്റ്, ആ ടി കുറച്ച് എക്സ്റ്റെൻഡ് ചെയ്യുക. വാട്ട്, ഐ എം നോട്ട് ബ്രേക്കിംഗ് ദാറ്റ് വാട്ട് ലൈക്ക് വാട്ട്, ഐ എം സെയിങ് what is. So that T is connecting to the I sound of S. What is your name? So S is in the S അടുത്ത your ആണ്. So your in the Y ലേക്ക് കണക്ട് ചെയ്യുന്നു, your in the R name in the N ലേക്ക് കണക്ട് ചെയ്യുന്നു. So it goes like, what is your name? So I'm not breaking, if you listen carefully, I'm not breaking what is your name, I'm saying what is your name. So that is how we practice the fluency.
Absolutely. And what you can do is, so what people do is they try to pronounce the word the way it is written. So it is not the way. So when you pronounce a word, things are different. So like I said, what's your name? She was giving you an example. What is your name? Even if you're saying what is, then you have to be like connecting the words. Yes, of course. But if you observe how a word is pronounced or how a sentence is pronounced, you can have a whole different spelling for that. Yes. So for pronunciation, have you seen the pronunciation written like without using IPA? Nowadays we try to use the letters to write the pronunciation of words.
Easy to remember.
So similarly, when you listen a sentence, just try to write what you hear. Write what you hear, not the actual words. For example, if you're hearing what's your name, so it's actually what's. So what's is actually WHATS. That's what I'm hearing. Like what's your name? Your is not your, it's Your.
Like Y-O-R, your.
Your. What's your name? What's your name? And sometimes if you're really fast, you're not pronouncing it. You don't have to go to that extent, okay? What I'm trying to tell you is, if you do shadowing, if you listen to an audio and repeat it after them, at the end of the day, you would have some fluency. You wouldn't reach 100%. You're mimicking, at first you may sound like you're faking. It's okay, but over time you will see improvement. Like she said, there is mental fluency and physical fluency, and this is something called muscle memory. Just like our body has got muscles, and when you go to gym after a long time, you can actually do anything. So because the muscles haven't been moving. Same way, you feel like my mouth muscles are moving because I speak in my Malayalam, in my mother tongue, Malayalam.
I actually experienced this during the Corona time.
Yes.
Because there was a break, we all got a long vacation kind of a period.
Yes.
And I was not actually speaking in English.
Yes.
Allada nokumbo, yes, on a daily basis I talk in English for a very long time. Maybe from the morning till the night, even when I have night classes and all, I continuously talk in English. Appo samsarikkumbo, the fluency issue is not at all a problem.
Yes.
But I realized the gap that I got is Corona time. I got like I think 1 or 2 months of break. After that, I started taking an online class, and I was not able to talk. Like I know but I was stammering too much, and I was finding it like no, I was not, and I don't talk like this. I could do it better.
Yes.
So I was getting stuck because for 2 months I didn't practice, or
yes.
I took a break from talking in English or speaking
Absolutely.
in English. I was watching all the sitcoms. Yes, we had a lot of free time, so yes, I was watching a lot of movies and sitcoms, but I was not using it. I was getting it, but I was not using it. So if you take a break, അത് നമ്മുടെ സ്റ്റുഡൻസിനും വരാറുണ്ട്. നിങ്ങളിപ്പോൾ ഒരു സാറ്റർഡേ സൺഡേ ഒരു വീക്കെൻഡ് ബ്രേക്ക് കിട്ടി, നിങ്ങൾ മൺഡേയിൽ വന്ന് ഒന്ന് 1-to-1 സെഷനിൽ സ്പീക്കിംഗ് ചെയ്യുമ്പോഴേക്കും അപ്പോഴും നിങ്ങൾക്ക് ഒരു സ്റ്റാർട്ടിംഗ് ട്രബിൾ വരാം. ഈ 2 ദിവസം നിങ്ങൾ ചെയ്യാതിരുന്നിട്ട് മൺഡേ ചെയ്യുമ്പോൾ പോലും ഒരു സ്റ്റാർട്ടിംഗ് ട്രബിൾ വരും. അപ്പോൾ ഒരു 2 മാസത്തെ കാര്യം ഒന്ന് ആലോചിച്ച് നോക്കുക. ഇറ്റ് വിൽ ബി ഹ്യൂജ് ഗ്യാപ്പ്. അത് കഴിഞ്ഞ് പിന്നെ കണ്ടിന്യൂസ് സംസാരിച്ചാണ് നമ്മൾ ആ ഒരു ട്രാക്കിൽ ലൈക്ക് മേ ബി 1 or 2 days time you will get back to track. പക്ഷെ always remember you need that constant practice.
Yes, it's very important. And I would say till your exam, limit the contents you're watching to English only. Avoid watching because you don't have a lot of time with you. You just have limited time. So during that time, just try to, like the word I like to use is like expose yourself to more of English content.
That's right.
All right? So that you're listening, and then even if you're not doing, and do this practice for 15 minutes or 10 minutes every day. So you're listening to it and it's in your head, and then you're practicing it and you're giving these movements to the mouth. Like you said, I've experienced the same thing as well. If I don't speak for like few days, then I'm like, when I start speaking, I feel like my mouth isn't just moving. It's not flowing. Words are not
here, but we are not able to come with the right
and
word.
we have this feeling that we can speak that way, but we're not able to.
Yes.
And that's frustrating. So if you haven't done this, imagine how would it be for you.
Yes.
So you should do this, okay?
Yeah. All right, so we'll have a quick discussion of this card.
Yes, sure.
So you can see that on the screen right now. So the setting is given as patient's home. So yes, it is a home visit.
Yes.
And the background information says a 72-year-old patient recovering from sepsis was discharged 3 days ago after 1 month of treatment in the hospital. You're visiting the patient to dress his or her wound. So this is the basic contextual information that you have. We just got the idea of the patient, what is his problem, he was discharged and things like that, but we are not getting any details saying that you were taking care of this patient.
Absolutely.
Okay, 1 month hospital ഉണ്ടായിരുന്നു, I agree to that. പക്ഷേ ഇവിടെ എവിടെയും ആ 1 month നിങ്ങളുടെ കെയറിലായിരുന്നു എന്നോ അല്ലെങ്കിൽ you just examined the patient എന്നൊന്നും തന്നിട്ടില്ല. ആ ഒരു 1 monthൽ ആ ഹോസ്പിറ്റലിലുള്ള വേറെ ഏതെങ്കിലും nurse ആയിരിക്കാം അവർ നോക്കിയിട്ടുണ്ടാവാം. So we don't have a clarity to the point that you are the nurse who took care of this patient. Therefore, we have decided to introduce ourselves in this context. So you know the introduction here. We'll start with good morning. My name is Richa. I am the registered nurse from the hospital. So I just said Greenwich Hospital. Nowhere it is mentioned any name, so I'm just coming up with it. So I'm saying I'm from the Greenwich Hospital. And are you Miss Joanne? You have to confirm that.
Yes.
The reason why I'm confirming that is because നമ്മൾ നേഴ്സിൻ്റെ പേര് ഇൻട്രൊഡ്യൂസ് ചെയ്യാൻ തീരുമാനിച്ചതിൻ്റെ അതേ റീസൺ തന്നെയാണ് നമ്മൾ ആ ഒരു കൺഫർമേഷൻ ചെയ്യാനും നമ്മൾ യൂസ് ചെയ്യുന്ന സെയിം റീസൺ ബിക്കോസ് ഇറ്റ് ഇസ് നോട്ട് മെൻഷൻ ദാറ്റ് യു ഹാവ് മെറ്റ് ദിസ് പേഴ്സൺ ബിഫോർ സോ വി ആർ കൺഫർമിങ് ദിസ് ഇസ് ദ സെയിം പേഴ്സൺ ദാറ്റ് യു ഹാവ് കം ടു മീറ്റ് ആൻഡ് ആഫ്റ്റർ ദാറ്റ് യു ഹാവ് ടു സ്റ്റേറ്റ് ദ പർപ്പസ് ഓഫ് യുവർ വിസിറ്റ് സോ ക്യാൻ യു എക്സ്പ്ലെയിൻ വിത്ത് എ സെൻറ്റൻസ് how
to sure, but I have one question. So can you also give them an example if it had been given that you examined the patient day before yesterday and now you're going for a home visit. So in that case, how will we start? We'll just start with good morning.
Good morning, Ms. Joanne. How are you feeling today? Simple as that because kind of so you don't have to, but you have to state the purpose why you are there.
Okay.
So when you ask how are you feeling today, definitely Joanne will give you an answer. So adinu acknowledgement kodutittu, so Ms. Joanne, I'm here as advised by the doctor to assess your progress. How have you been? You can ask like that.
Okay.
That
so
is very easy.
So we can totally eliminate the introduction part where you're introducing yourself and then confirmation. Yes, these two parts can be. So we can start with how are you feeling, how are you doing, and things like that. Okay, coming on to the first task, confirm the reason for your visit. So it's just simple. Example, wound management after sepsis. Find out how the patient has been since discharge. Example, mobility, fatigue, appetite, etc. So you can just say, I've come here today to dress your wound and to make sure everything is going well after your sepsis.
As that's right. So it is mentioned here, you're visiting, the purpose is already given here. So this is your purpose. So what you just need to do is you have to just say, I'm here to dress your wound. That is the only purpose which is mentioned here, but we are just additionally adding one point and to check your progress.
Yes.
And to check your progress. So that is your introductory part.
Yes.
And then the patient is saying, yeah, okay, fine, no problem, come inside. The patient is happy to welcome you. Then you have the second portion, you have to check how the patient have been feeling since the discharge. So I'll show you a very easy method to create a sentence and this method is for people who find it difficult to construct statements.
Absolutely.
Find out is your action verb here. So you can expand that into I would like to know about. So about is already there. So for find out is already here. So you can say I would like to know about. How is already there. Patient will be changed to you. And when it is you will change has into have. So that is a simple sentence. You can say I would like to know about how you have been since discharge.
Yes.
So the same basic sentence can be used to construct the question. So instead of find out, you are saying I would like to know about how patient is changed to you, has is changed to have, been since discharge.
Yes.
Then you have to frame questions for each of this. So mobility is like, do you have any mobility issues? And fatigue is like, do you feel tired most of the time? What about your appetite?
Yes.
Or if you want, you can change that question. Do you eat well enough?
Yes.
Are you able to eat enough food? Or
Yes.
do you have any trouble eating food? You can ask questions like that. So that is how you can do task number 1. So let's look at task number 2.
Yes. Explain the importance of good nutrition. Example, aid recovery, building up strength, etc. Find out about patient's food and fluid intake. Example, amount, frequency, etc.
Yeah.
So we can say something like, okay, so we are going to explain them the importance of good nutrition. So just simple thing, just taking the words from the question itself, you can say, it's important that you eat nutritious food because it would help your recovery and it would help you have speed of recovery and also build up strength.
Very good. So it is very easy and you can, if you have noticed, there is a connection from this point to this task because the last previous question that we asked the patient is like about the food, whether the patient is able to eat enough food, and the response the patient said was no, I'm not eating as like I have used to eat food. And the next task you can see, you are telling the patient the importance of having good nutrition. So there is a connection. Food ഞാൻ അധികം കഴിക്കാറില്ല എന്ന് പറയുന്ന ഒരാളോട് അങ്ങനെയല്ല നിങ്ങൾ നല്ല ഫുഡ് കഴിക്കണം എന്ന് പറയുന്ന ഒരു ടാസ്ക് വരുമ്പോൾ it is a continuation. So what you can do is ഇവിടെ നിന്ന് നമുക്ക് ഇങ്ങോട്ട് കണക്ട് ചെയ്ത് ഡയറക്റ്റ് ആയിട്ട് പോവാം. അത് നമുക്ക് ഡയറക്റ്റ് ആയിട്ട് തന്നെ ചെയ്യാം, സൈൻ പോസ്റ്റ് ചെയ്യേണ്ട ആവശ്യമില്ല, ബിക്കോസ് ദർ ഇസ് നോ ചേഞ്ച് ഇൻ ടോപ്പിക്, അതൊരു കണ്ടിന്യൂസ് ടോപ്പിക് തന്നെയാണ്. സോ ഇപ്പോൾ ഒരു പ്രീവിയസ് കോൺവെർസേഷൻ നോക്കുവാണ്, ദ പേഷ്യൻ്റ് ഈസ് സെയിങ് ഐ ഡോണ്ട് ഈറ്റ് ആസ് മച്ച് ആസ് ഐ യൂസ് ടു എന്ന് പറയുമ്പോൾ ഐ ക്യാൻ ടോട്ടലി അണ്ടർസ്റ്റാൻഡ് ദാറ്റ്, ബട്ട് ലെറ്റ് മി ടെൽ യു ഇറ്റ് ഈസ് വെരി ഇമ്പോർട്ടൻറ്റ് ദാറ്റ് യു ഹാവ് എ ഗുഡ് ന്യൂട്രീഷ്യസ് ഡയറ്റ്. സോ അതൊരു കണ്ടിന്യൂസ് ലൂപ്പിൽ നമുക്ക് പറഞ്ഞു പോവാം. ദിസ് ഇസ് ഹൗ യു കണക്ട് ദ പോയിന്റ്സ്. പ്രീവിയസ് കോൺവെർസേഷനുമായിട്ട് ഒരു കണ്ടിന്യൂസ് ആസ്പെക്റ്റിൽ നമുക്ക് ചെയ്തു പോവാം. ഓക്കെ, can you create a sentence for this portion?
Find out about patient's food and fluid intake, amount, frequency. I'd like to know, you can say in different ways, like I'd like to know, or have you been keeping yourself hydrated and eating food?
Yes.
Like how often do you eat your food and the quantity of food you eat?
So ഇവിടെ ഹാന ചെയ്തത്, ഹാനൻ്റെ മീനിങ് മനസ്സിലാക്കി, ആൻഡ് ദെൻ ഷീ ക്രിയേറ്റഡ് എ സെൻറ്റൻസ് ഫ്രം ഹെർ പ്രൊഫഷൻസി ലെവൽ. ഇനി നമുക്ക് വളരെ സിമ്പിളായിട്ട് നോക്കുകയാണെങ്കിൽ എഗെയിൻ ഫൈൻഡ് ഔട്ട് ഉണ്ട്. സോ ഇവിടെ നമ്മൾ ഐ വുഡ് ലൈക്ക് ടു നോ എന്ന് നേരത്തെ യൂസ് ചെയ്തുകൊണ്ട് ഇവിടെ വി ക്യാൻ ട്രൈ സംതിങ് ലൈക്ക് കുഡ് യു പ്ലീസ് ടെൽ മീ, ഓർ ഐ വുഡ് ലൈക്ക് ടു നോ അബൌട്ട് യുവർ ഫുഡ് ആൻഡ് ഫ്ലൂയിഡ് ഇൻടേക്ക്. ഇവിടെ നമുക്കൊരു കണക്ടർ യൂസ് ചെയ്യാം, മൂവിങ് ഓൺ. Okay, instead of I would like to, you can say I need to know about it. I would like to then എപ്പോഴും പറയണമെന്നില്ല. Next can be moving on, I need to know about your patient എന്തായിട്ട് മാറും, your food and fluid intake, amount and frequency. വേണമെങ്കിൽ ഡയറക്റ്റ് ആയിട്ട് നമുക്ക് ചോദിക്കാം, can you tell me about the amount of food and fluid along with the frequency of it എന്ന് വേണമെങ്കിൽ ഡയറക്റ്റ് ചോദിക്കാം. ഇത് അതല്ലാന്നുണ്ടെങ്കിൽ സ്പ്ലിറ്റ് ചെയ്തും നമുക്ക് ചോദിച്ചു പോവാം. Can you tell me about the amount of food and fluid you take? Frequency, how often do you take it? Okay, two different questions too. Okay, so I hope that is clear to everyone. Let's look at task number 3.
Provide diet suggestions, little but often preferred foods, nutritional high-calorie foods, supplemental nutrition drinks, etc. Explore other symptoms, example pain, fever, swelling, sleeping, etc. So we have two things to do. One is provide diet suggestions. So I'd like to recommend, you can say it is recommended that you eat little but very often.
It is recommended, very good, or it's advisable, or let's look into the importance of having a proper diet plan. You can just come up with sentences like that. It's not necessary you have to always stick on to I would like to. അത് കേൾക്കുമ്പോൾ ഭയങ്കര അരോചകമായിട്ട് ഫീൽ ചെയ്യും, like when you repeat the same thing over and over again. So try to learn the different versions of that too. Yes. Please continue.
So it's recommended or it's advised that you eat a little but often. That means you can reduce the number, the amount, the portion, but you have to eat often. And you can eat your preferred food or high-calorie nutritional foods or supplemental nutrition drinks.
Yes.
Okay, and do you have pain or fever, or do you have swelling, and how have your sleep been?
Yeah, so here ഇത് രണ്ട് topic ആണ്. So in the first one we are providing diet suggestion, which is information giving. അങ്ങോട്ട് നമ്മൾ പറഞ്ഞു കൊടുക്കുന്ന information ആണ്. So that is one method. The second one is explore other symptoms, which means symptoms നെ പറ്റി ചോദിച്ച് മനസ്സിലാക്കുക, which is the opposite of information providing, which is information gathering. So there is a change in topic. Whenever there is a change in topic, you have to signpost.
Okay.
Which is a must. ഇത് ചെയ്തില്ലെങ്കിൽ നിങ്ങളുടെ സ്കോർ അവിടെ റെഡ്യൂസ് ചെയ്യും. സോ വാട്ട് യു ഹാവ് ടു ഡു ഇസ് ആഫ്റ്റർ യു എക്സ്പ്ലെയിൻ ടു ഹാവ് സപ്ലിമെൻ്റൽ ന്യൂട്രീഷൻ ഡ്രിങ്ക്സ് ആൻഡ് ദെൻ യു ക്യാൻ ആസ്ക് എ ക്വസ്റ്റൻ, ഐ ഹോപ്പ് യു വിൽ ഡു ദാറ്റ് ഓർ വിൽ യു ബി ഏബിൾ ടു ഡു ദാറ്റ് എന്നൊരു ക്വസ്റ്റൻ ചോദിക്കുക. യു വിൽ ഗെറ്റ് എ റെസ്പോൺസ് ടു ദാറ്റ്. ദെൻ ആഫ്റ്റർ ഗെറ്റിംഗ് എ റെസ്പോൺസ് ടു ഇറ്റ് യു ഹാവ് ടു മൂവ് ഓൺ വിത്ത് എ സൈൻ പോസ്റ്റിംഗ്, സംതിങ് ലൈക്ക്. സോ ആസ് വി ഗെറ്റ് ഇൻ ടു ഫർദർ ഡിസ്കഷൻ ഐ വുഡ് ലൈക്ക് ടു ആസ്ക് യു ക്വസ്റ്റൻസ് അബൌട്ട് യുവർ സിംറ്റംസ്. അതൊരു സൈൻ പോസ്റ്റിംഗ് സ്റ്റേറ്റ്മെൻ്റ് ആണ്. സോ ദെൻ ദ പേഷ്യൻ്റ് വുഡ് നോ എൻ്റെ സിംറ്റംസിനെ പറ്റിയിട്ടാണ് ഇപ്പോൾ ചോദിക്കാൻ പോകുന്നത്, ആൻഡ് ദ പേഷ്യൻ്റ് വിൽ ബി റെഡി, ആൻഡ് ദെൻ യു ക്യാൻ ആസ്ക് ദ ക്വസ്റ്റൻസ് വൺ ബൈ വൺ. സോ വെനെവർ ദർ ഇസ് എ ചേഞ്ച് ഇൻ ടോപ്പിക് ലൈക്ക് ദിസ്, യു ഹാവ് ടു സൈൻ പോസ്റ്റ്, വിച്ച് ഇസ് എ മസ്റ്റ്. Don't forget that. Okay? Yes, Hannah, take over.
Next one, remind patient about sepsis recovery. Example, fatigue normal, slow gradual process, and find out any concerns. It's okay and it's normal to feel fatigued and tired, and your progress will be slow and gradual. There is nothing to be worried about. Do you have any questions?
Yes, exactly. Very direct and a very easy task. You don't have to have any complications here. You can simply tell the patient, well, I understand you're concerned about a recovery, but let me assure you that this fatigue that you're feeling is quite normal in this case, and even though it is a slow process, there will be a gradual improvement in your condition, so don't worry about it.
Okay.
Slow ആണെങ്കിലും gradual ആയിട്ട് അത് improve ചെയ്യും. Don't worry about it. And then you have a very direct question, do you have any other concerns? It's a very direct question given there. Okay, now let's look at task number 5.
Reassure patient about his or her current condition. Example, recovery is expected, no cause for concern. Outline next steps. Example, checking and redressing the wound, checking vital signs, doctor's appointment, precaution, etc. So here you can say, I reassure you that there is nothing to be alarmed about. Your recovery is as expected and there is no cause for concern. And now I will be checking and redressing your wound, and after which your vital signs will also be observed, and as a precaution I can arrange an appointment with the doctor. Is that okay with you?
Absolutely. So that is how we can go over with that task, which is very direct. The only point is, after this portion, it would be good if we can pause and then say, I'll tell you what we are going to do next. Again, that is a change in topic.
Yes.
Okay. So again, you can signpost here. That will be also good. You can say, all right, Mr. David or Miss Joanna, let me tell you what I'm going to do right now. And then you can state the same thing like how Hannah has said. Okay. And the last one.
Establish patient's consent, have the wound checked and redressed. So I'm going to check your wound now. Is that okay with you?
Yes. Or you can say, so with your permission, shall I proceed with the dressing of your wound, or shall I check your wound and dress it for you? Okay, so that is how we can do this. So we hope this is clear to you guys and you guys learned something about how you can execute cards like this. So always remember, you constantly practice it, and I know you might feel like, why is she saying this point always whenever we come to listen to the live? But this is the main point you have to notice. Speak in English every day because you have to improve your language. Only then things will be easier for you. And ഇപ്പോൾ language ഉണ്ടെങ്കിൽ നിങ്ങൾക്ക് ഏത് കാർഡും നിങ്ങൾക്ക് പറയാൻ പറ്റും, ലൈക്ക് ബിക്കോസ് ഇറ്റ്സ് ഓൾ അബൌട്ട് ഈ തന്നിരിക്കുന്ന കാര്യം ഒരു സെൻറ്റൻസ് ആക്കി ഒരാൾക്ക് പറഞ്ഞു കൊടുക്കുക എന്നുള്ളൊരു കാര്യമാണ് നമുക്ക് ചെയ്യാനുള്ളത് അല്ലേ. സോ ഇഫ് യു ഹാവ് ദ ലാംഗ്വേജ് ഇറ്റ്സ് ഈസി ഫോർ യു ടു കമ്മ്യൂണിക്കേറ്റ്. സോ വാട്ട് യു ഹാവ് ടു ഡു ഇസ്, ഒരുപാട് കാർഡുകൾ ഒരു ദിവസം ഒരു 3-4 കാർഡുകൾ ചെയ്യുന്നതിന് പകരം, അല്ലെങ്കിൽ അത് ചെയ്യുന്നതിൻ്റെ കൂടെ തന്നെ വാട്ട് യു ഹാവ് ടു ഡു ഇസ് യു വിൽ ഹാവ് ടു ടോക്ക് ഇൻ ഇംഗ്ലീഷ്. ഇനിയിപ്പോൾ വാട്ട് ദേ വിൽ ഡു ഇസ് ദേ വിൽ സ്റ്റോപ്പ് പ്രിപ്പയറിംഗ് കാർഡ്സ് ആൻഡ് ദേ വിൽ ഓൺലി ടോക്ക് ഇൻ ഇംഗ്ലീഷ്.
No, they won't.
So what you have to do, then we'll say, yeah, റിച്ച്മൻ ലൈവിൽ പറഞ്ഞായിരുന്നു കാർഡുകൾ ഒരുപാട് ചെയ്തിട്ട് കാര്യമില്ല, ഇംഗ്ലീഷ് സംസാരിച്ചാൽ മതി.
Don't underestimate them. They're really smart people.
So what I'm trying to say is, do cards as much as possible. നിങ്ങൾ കോണ്ടെക്സ്റ്റുകൾ മനസ്സിലാക്കുക, സിനാരിയോസ് മനസ്സിലാക്കുക, which is very beautiful to do. അത് ചെയ്യുന്നതിൻ്റെ ഒപ്പം തന്നെ ഇംഗ്ലീഷിൽ സംസാരിക്കുക. And when I say talk in English, try to have daily conversations like, hey, how are you? How have you been? Like, yes, what is for your lunch? You can have very simple conversations. കളിയാക്കുന്നവർ കളിയാക്കിക്കോട്ടെ, we don't have to bother about it. Don't listen to them, don't lend your ears to such people, okay? You have a vision, you have a goal, so just work for that. Always talk in English, it is very very important. ഒത്തിരി നേരം അല്ലെങ്കിൽ ഒരു 10 മിനിറ്റെങ്കിലും സംസാരിക്കാൻ പറ്റില്ല, that is the best thing you can do. So ഒരു 10 ദിവസം കണ്ടിന്യൂസ് ആയിട്ട് നിങ്ങൾ ഒരു 10 മിനിറ്റ് സംസാരിച്ച് നോക്കിയാൽ, starting today you will see the difference. Yes. When the gap between you and English is coming closer and closer, things will be much more easier for you. You don't have to worry about it. ഇപ്പോൾ ഇങ്ങനത്തെ ഒരു കാര്യം മലയാളത്തിൽ പറഞ്ഞു കൊടുക്കാൻ പറഞ്ഞാൽ ഈസി ആയിട്ട് പുഷ്പം പോലെ നമുക്ക് പറയാൻ പറ്റില്ല. വൈ? ബിക്കോസ് ആ ലാംഗ്വേജ് നമുക്ക് ഭയങ്കര ഈസിയാണ്. മലയാളം ആയിക്കോട്ടെ, ഹിന്ദി ആയിക്കോട്ടെ, തെലുങ്ക് ആയിക്കോട്ടെ, വാട്ട് എവർ ദ ലാംഗ്വേജസ് നിങ്ങൾ ഭയങ്കര പ്രൊമിനൻ്റ് ആയിട്ട് യൂസ് ചെയ്യുന്ന ലാംഗ്വേജ് ഏതാണോ അതിൽ നമുക്ക് ഈസി ആയിട്ട് കമ്മ്യൂണിക്കേറ്റ് ചെയ്യാൻ പറ്റും. ലൈക്ക് വൈസ് ഈ ഒരു ലാംഗ്വേജും നിങ്ങൾ ഒത്തിരി സംസാരിക്കുമ്പോൾ ഇറ്റ് വിൽ ബി ലൈക്ക് ഈസി ഫോർ യു, ഈസി പീസി. ഓക്കെ, സോ അപ്പോൾ നമുക്ക് കുറച്ചുകൂടെ ബെറ്റർ ആയിട്ട് സംസാരിക്കാൻ പറ്റും. ഓക്കെ, സോ ദാറ്റ്സ് ഓൾ ഫോർ ടുഡേ. വി ഹോപ്പ് ഇറ്റ് വാസ് informative and helpful for you guys. If yes, let us know in the comment section. So Hannah and I will be coming again with another live session. Until then, take care. Good night.